Thank you, Last Ceann Comhairle, and I welcome the opportunity to address the issues raised in this motion. Everyone here will agree that the state, together with the religious congregations, must acknowledge the indisputable wrongs that were visited on the women and children who spent time in mother and baby and county home institutions. As the Taoiseach said in his apology on behalf of the state in January last year, they should not have been there, and the shame is ours, not theirs. Throughout my 2 years in this role, I've worked to progress the state's response to mother and baby institutions, mindful of the decades of complicity and inaction that have marked the state's involvement in mother and baby institutions and their legacies. I know how deep that legacy runs and the very personal pain and trauma that so many of our citizens endured. I've met many survivors over the past 2 years. I've had people approach me and tell me of their experiences in institutions and the impact it has had on them. The different impacts of time spent in these institutions is impossible to disentangle, and there are no easy answers when it comes to trying to remedy the grief and the anguish. For each survivor of these institutions, the experience has had a unique and deeply personal impact. It's not possible to monetize the suffering or the losses experienced in any payment scheme. It's also not possible to provide one remedy by way of compensation to all and for all, nor is it sufficient to attempt to do so. The Government's action plan for survivors and former residents of mother and baby and county home institutions aims to provide an enduring response to the priority needs of those concerned. Recognising that redress means different things to different people, the action plan spans significant commitments across the areas of apology, access to personal information, health supports, financial payments, memorialisation, records, archives and databases, education and research, and dignified burial. Delivering on these commitments for survivors is a priority for myself and for the Government, with 8 of the 22 commitments achieved and intensive work underway on many others. First and foremost, Government has ensured that counselling support is available to all survivors, free of charge and with prioritised access. The Birth Information and Tracing Act 2022 became law in June, and from the 3rd of October, statutory information and tracing services under the Act opened, guaranteeing people a long overdue legal right of access to their birth and early life information. After 2 decades of promises, this Government has finally delivered full and unredacted access to identity rights for adopted people and those who were boarded out. In the first 2 weeks, over 4,000 applications have been received under the new Act. In July, the Institutional Burials Act 2022 also became law, and Government approved my proposals to establish an independent office to lead an intervention at the site of the former mother and baby institution in Tuam. The treatment of children's remains in Tuam is a stain on our national conscience. My hope is that this process will deliver answers that can bring some solace to the families who have been so deeply affected by this abhorrent situation. In March, Government approved proposals for a national centre for research and remembrance. The centre will stand as a site of conscience and will be a national memorial to honour equally all those who were resident in mother and baby homes, industrial schools, reformatories, Magdalen laundries and related institutions. Will comprise a museum and exhibition space, a research centre and repository of records related to institutional trauma in the 20th century, which will form part of the National Archive, and a place for reflection and remembrance. The site for this centre at Sean McDermott Street has already been transferred from Dublin City Council to the Office of Public Works. Deputies will also be aware that I secured Government approval last week for the Mother and Baby Institution Payment Scheme Bill. Following its publication by the Bill's Office, I'll present this to Dáil Éireann next week. The scheme set out in the bill, while the largest of its kind in the history of the state, is nevertheless just one element of the overall Government response. The redress scheme proposed goes far beyond what the Commission proposed, and indeed what was proposed by the interdepartmental group established to draw together a scheme. The Commission recommended that pregnant women who entered mother and baby homes or county home institutions before 1974 would be eligible. We have gone beyond that recommendation to ensure that the scheme includes all women who were resident in an institution at any point. The Commission recommended that only children who were unaccompanied in a mother and baby or county institution would be eligible for a payment. We have gone beyond that recommendation, and the scheme will now include all children who are resident in a mother and baby or county home institution for more than 6 months. The Commission recommended a scheme in which 6,500 people would benefit at a total cost of €400 million. We have gone substantially beyond that. The proposals contained in the state scheme will benefit 34,000 people at a total cost of €800 million. 19,000 former residents will receive an enhanced medical card. It will be, in terms of the number of beneficiaries, the largest redress scheme in the history of the state, recognising the huge impact that these institutions had on Irish society. For children who spent very short periods of time in an institution during their infancy, the Government's action plan provides a response to their needs in the Birth Information and Tracing Act and the investment that has been made in new services under that Act. The legislation provides guaranteed access to birth certificates, as well as wider birth and early life information for those who have questions in relation to their origins. This is the overwhelming priority need which has been expressed by people who as children were adopted or otherwise separated from their birth family. The Act also supports contact and family reunion by establishing a statutory tracing service and a contact preference register. Since the approval by Government of the institutional payment scheme proposals, I've made further enhancements. I've improved the overall payment approach by introducing a more refined payment bands that will benefit many applicants to the scheme. Previously, a person in an institution for 5 years and 1 month and 5 years and 11 months would have received the same payment. Under the new banded system, the person who had been in the institution for 5 years and 11 months will receive a proportionately higher payment, recognising the longer period. I've also introduced a feature in the calculation process that will include periods of temporary absence of up to 180 days in the records of some applicants, enabling a more just approach to those impacted. It would be unjust to deny or limit access to the scheme on the basis that a person was absent from the institution because they spent time in a hospital as a result of an illness contracted due to the appalling conditions in those institutions. The scheme will recognise harsh conditions, emotional abuse, and all other forms of harm, mistreatment, stigma and trauma experienced while resident in a mother and baby or county home institution. However, in keeping with the views of survivors as expressed in the consultation process, the scheme will be non-adversarial with a low burden of proof. Applicants will not have to bring forward evidence of abuse, harm or mistreatment in order to benefit from the scheme. Rather, a general payment approach based on time spent will allow the state to shoulder the burden of proof and to seek to ensure that this scheme causes no further harm or trauma. I am acutely aware of the need to deliver this scheme as swiftly as possible so that benefits can be accessed by many thousands of survivors and former residents. As the bill travels through the House, I know that I can count on the goodwill and good intent of all deputies and senators so that we can complete this legislative process promptly. In parallel with finalising the legislation, the significant work required to establish the scheme is underway. This work includes establishing an independent executive office based out of my department to respond to applications and administer the payments. I want to assure survivors that we will be doing everything in our power to deliver the scheme as quickly as possible and to prioritise applications from older and more vulnerable survivors. In closing, I want to pay tribute to the immense resilience, courage, patience and constructive engagement of survivors and their supporters as the Government continues to work through these complex issues. No amount of money, of legislation or of memorialisation can ever truly undo the hurt that was done by these institutions. However, by vindicating the identity of people who were adopted or subject to illegal birth registration, by ensuring that the remains of the children buried at Tuam receive a respectful reburial, by bringing forward a payment scheme that will benefit 34,000 former residents, we are humbly acknowledging the state's duty to atone for these appalling wrongs and seeking to rebuild the relationship of trust with the people who were so grievously wronged. Thank you, Chair.